And so I have 101. Good afternoon, everyone. I'm going to get started, and Jenny, my wing woman, will admit anybody else who comes in a little later. Thanks so much for joining us for the last in our series of Medicare 101. This is enrollment periods and fine print. So let me get my slides up. And there we go. You will see in the chat box a link to a survey. We'll talk about that a little more when we get to the end. But this presentation is all about when you can enroll in the various parts of Medicare and the fine print. None of it terribly exciting, but certainly important. So as we've talked about before, most people sign up for Medicare Part A and B when they're first eligible. That's when they turn 65 or when they've been receiving Social Security disability benefits for 24 months. There are risks to signing up later, including a gap in coverage and possibly a late enrollment penalty. But there are some exceptions to that. There are life events that can make that a better idea to wait to sign up. So if you have active employee coverage at work, that's either you or your spouse. Most people, when they turn 65 or become eligible for Medicare, will sign up for Part A because there is no premium. Even though you still have coverage through an employer group health plan, Medicare then becomes your secondary payer, and it gets you into the system, and you are allowed to enroll in only Part A as long as you have other coverage. If you choose to enroll in Part B, you're going to pay a monthly premium for Part B. So part of this is figuring out which is going to be more cost effective for you, to hold on to your employer group health coverage if you're still working, or to go to Medicare Parts A and B and whatever else you need to supplement that. Now, when you lose your employee health insurance, so that could be you stop working and your spouse stops working, whoever has the coverage, and are no longer an active employee. You have an 8-month period during which you can enroll in Medicare without a late enrollment penalty. COBRA does not count, even though when you retire, you may be given the opportunity to continue your employer group health coverage through COBRA. That does not count. You must be an active employee. And so using COBRA does not extend that 8-month period. You also need to be careful if you are either losing or relinquishing your employer group health coverage, that you don't have a gap in benefits. And so if you want your Medicare benefits to start when your employer insurance ends, you need to sign up for Medicare at least a month before that happens. You can't sign up more than 90 days before that happens. So you've got a little bit of time in there, but your Medicare coverage will become a bit available to you and active the month after the month you sign up. So if you sign up on the 5th of July, it will become active and covering you on the 1st of August. If you sign up for Part B, when you lose your employer health insurance and you want to enroll in a Medigap supplement plan, remember we talked in an earlier session about guaranteed issue. Your guaranteed issue period starts when your Part B coverage begins. If you want to enroll in a Medicare Advantage plan, you must be enrolled in Part B, and you have to know your Medicare number. So again, you need to kind of time it out properly. If your employer stops providing coverage, your employer says, nope, not going to provide coverage for you anymore, you're eligible for that 8-month special enrollment period. That's also the case if you have retiree benefits that are at least as good as Medicare and your retirement plan or your union stops providing those benefits. So what if you wait longer than that? You're going to pay. You'll be assessed a late enrollment penalty of 10% of the Part B premium for every 12 months you could have enrolled but didn't. And that's every month added on to your Part B premium for as long as you have Medicare. And because the Part B premium tends to go up every year, the penalty will go up every year. You also cannot just decide after that 8-month special enrollment period that you're going to sign up tomorrow. You'll have to wait till the next general enrollment period, and that's January 1 to March 31 every year. And those benefits do not become available to you until July 1 of the year you enroll. So you could go quite a period of time without any health insurance. Now, when can you join a Medicare Advantage plan? Generally, either enrolling or switching from one plan to another can only be done in the open enrollment period of October 15th to December 7th. But certain events allow you to change or enroll outside that period. You're entitled to a special enrollment period when you first enroll in Part B, when you lose your employer group health plan coverage, if you move back to the United States after living abroad, or you move into, are living in, or move out of a long-term care facility. It's not a lot of flexibility, but there are some for certain events. You also have a special enrollment period for Medicare Advantage plans. And these are changes. To change from one plan to another. If you move to an address that isn't in your plan service area, you're no longer eligible for Medicaid. You enter or leave a PACE program. That's a program of all-inclusive care for the elderly. We have none in the Rockbridge area, but there are some. As a matter of fact, we have none in Planning District 6. There is a PACE program in Lynchburg, and there is one in Roanoke. Or your plan is sanctioned by Medicare, or its contract with Medicare is terminated or not renewed. You would be notified by mail that your plan was either being sanctioned or the contract was being terminated, and then you can choose another plan outside of the open enrollment period. Medicare prescription drug plans is essentially the same thing. You normally can only enroll or switch from one plan to another during that open enrollment period in the fall. But certain things allow you to enroll or change outside that period. When you first enroll in Part A, you do not have to have Part B in order to enroll in a drug plan, only Part A. You lose your employer group health plan coverage. You move back to the States. You're moving into, living in, or moving out of a long-term care facility. Or you become eligible for extra help for paying the premium for your drug plan. You can change if you move to an address that isn't in your plan service area, you're no longer eligible for Medicaid. You enter or leave a PACE program, you get a chance to get creditable coverage through your employer, your union, TRICARE, or the VA, which are both federal programs. Or your plan is sanctioned or its contract not renewed by Medicare. So does anyone have questions about special enrollment periods? Hearing none, we'll go on to the fine print. And again, this is not the most exciting thing in the world, but if it applies to you, it's important. Here's what Medicare doesn't cover. It does not cover long-term care that is custodial care. It will cover long-term care for recovery and rehabilitation, but not for custodial care where you are not really expected to leave that facility. It does not cover most dental procedures, except in the case of injury or disease. Dentures, the eye exams for prescribing glasses. It's called the refraction exam. I just had my eyes examined, and at my eye doctor, it was $30 that I owed because Medicare does not cover eye exams for the purpose of prescribing glasses. It does not cover eyeglasses themselves, with a few exceptions. When you have cataract surgery, it will pay for one pair of glasses. But in most cases, it does not pay for eyeglasses. It does not pay for hearing aids and exams. It does not pay for routine foot care. If you have a disease or injury or medical condition that requires professional attention in your feet, that would be covered, but routine foot care, things like nail trimming, are not covered. It does not cover acupuncture, and it does not cover cosmetic surgery. Here's the thing, even though you may have the best supplement in the world, if Medicare doesn't cover it, your supplement's not going to cover it either. Your supplement covers the part that Medicare doesn't pay for approved Medicare charges. This is becoming increasingly important, knowing if you're an inpatient or an outpatient in the hospital. You're an inpatient only when you're formally admitted to the hospital by a doctor's order, and that's covered by Part A. If you are put into say you enter the hospital through the emergency department, and they keep you there for a while, and then they put you in a gown with no back and put a bracelet on you and take you to a bed upstairs, ask whether you are being admitted as an inpatient or not, because that's not necessarily the case. You're an outpatient, and that's covered by Part B. When you're in the hospital receiving ED services, you go for outpatient surgery, you go for tests, scans, x-rays, you're there for observation status. And we're going to talk a little bit about observation status. So even if you spend the night in a hospital bed, doesn't mean that you're an inpatient. This usually happens through the ED. The doctor just wants some more time to decide whether or not to admit you as an inpatient. They will hold you in what's called observation status. They may well put you in a regular bed on the regular floor of the hospital. But if you are kept in observation status for more than 24 hours, you must be given written information that you are there as an outpatient. If you're receiving observation status, Medicare treats you as an outpatient, not hospitalized. And Part B is the payer on that, not Part A. Nights spent in observation status don't count toward eligibility for skilled nursing services. You may recall that we talked about eligibility for skilled nursing services is 3 nights in a hospital before transfer to a long-term care facility or skilled nursing facility. If you're receiving emergency services or observation services, Part B will not cover the cost of self-administered drugs. So they hand you one of those little paper cups with 2 something or others in, and you take them, and with a swallow of water, that's a self-administered drug. And you're responsible for 100% of the cost of that. Part B will not pay it. Now, your prescription drug plan may reimburse you for it or for part of the expense, but you will have to bill generally the prescription drug plan yourself and be reimbursed. They will not pay the hospital directly under normal circumstances, and you are responsible for paying the hospital. We all know that you can be in the ED and they can give you your normal maintenance medication that you'd normally take and charge you $7, $10, $15 a pill for it. If you are in that situation, it is worth negotiating with the hospital to take as payment whatever your drug plan will pay, will reimburse you for. Doesn't always work, but it never hurts to try. The worst they can do is say no. Now, there are some drugs that are covered by Part B, but they're few and far between. It only covers drugs that are delivered via durable medical equipment. That's an infusion pump or a nebulizer. People with insulin pumps, their insulin is covered by Part B. If you're using a nebulizer, the medication that's put into the nebulizer is covered by Part B. Drugs that are infused or injected by a medical provider, not self-injected like many self-injected insulins and other drugs like Humira are often self-injected. But if you need to go to a medical provider to have an IV or to have the injection, Part B will cover it. There are certain oral cancer drugs that Part B will cover. Your provider should know about this. They're often ordered through specialty pharmacies. And basically, the simplest explanation I can come up with is if the oral drug is metabolized at a level that is equivalent to having the drug infused, they will pay for it. Part B covers vaccinations and inoculations under most circumstances. It does not cover the shingles vaccine. I don't know why, but it doesn't. An important piece of this is if you choose to have a Medicare Advantage plan and you want to get your flu shot, your COVID booster, your pneumonia shot, you need to show them your Medicare card, not your Medicare Advantage card, because that's how it gets billed. And Part B covers drugs that treat certain conditions like end-stage renal disease or post-transplant therapies. And again, your providers will know that because those are pretty particular situations. Skilled nursing care. If you have days left in your Part A benefit period, and remember, your Part A benefit period starts over again when you have not been hospitalized for 60 days. And you have a qualifying hospital stay, that's 3 nights in the hospital, and your doctor determines that you need skilled nursing or rehab, and you get services in a Medicare certified nursing facility, and once you get there, you do not refuse their treatment or services, then Part A will pay 100% of the costs for days 1 to 20, and all but this year, $194.50 a day for days 21 to 100. So do we have questions about special enrollment? I mean, about drug coverages, fine print, those sorts of individual situations where something covers it and something else doesn't? Okay. We will be offering this course again, probably right after the first of the year in an evening time setting for people who are working and don't have the flexibility to join us during the day. But for those of you already enrolled in Medicare, I would give you a heads up that we are fast approaching the open enrollment season of October 15th to December 7th. If you would like our help evaluating the various Medicare Advantage plans and prescription drug plans that will be available for 2023, give us a call and make an appointment. Starting about mid-September, we will start to take appointments. You can call your local VPAS office and request an appointment with a Medicare counselor. I will be, Julie's asked, are you going to share these slides from the session as you have for the others? Yes, I will let you know when the video is up on our YouTube. And this one doesn't have any handouts with it, but I will be sharing the slides. So this is a specific thing for this particular session. ACL is the Administration for Community Living. They randomly select group education sessions such as this one to survey the participants. I'm supposed to read this to you, so here goes. At this time, I'd like to give you the option to complete a satisfaction survey. This survey was developed to be part of a larger analysis of our national program. I did not create the survey, and I will not see any of your responses. This survey is completely voluntary and should take less than 5 minutes to complete. It is also anonymous. You're not required to include any personal information such as name, date of birth, or location. If you'd like to participate, please click on the link in the meeting chat box. And if you provided your email address, and all of you have, I will send you an email with the survey link as well. So let me know if you have any questions on that. That email will go out to you immediately upon our being done with this webinar. So I am open for questions again, and would love to know if there are other subjects that you would like us to provide webinars or education sessions on, whether that's Medicare, whether it's other things. We're working on one right now on what's called polypharmacy, which is the use of many drugs, because it can be a little dangerous to be on too many medications, and something you need to keep it kind of track of. So does anyone have suggestions? You can put them in the chat box. You can open up your mic and let me know if there's anything that you would like to see us offer in the future.
Jerry, could you put the phone number back up again? We missed it, please, and thank you.
Sure. Our phone number in our Waynesboro office is 868-VPASS, 800-868-VPASS. If you look in your phone book under Valley Program for Aging Services, we have offices in Harrisonburg, in Buena Vista, in Waynesboro, in Warm Springs, and in Monterey. And any of them can make appointments for you. If you think it would be helpful, I can add those numbers to the email that I'm about to send you with the survey link. Anyone else? Thank you all for joining us today. I appreciate your attention, and stay tuned for more offerings as we put them together. Thank you so much.
Jerry, I just, someone did give me a suggestion on any, do you ever do programs on social security tricks, tips on Social Security?
We do not do much Social Security, but we have friends at Social Security who are more than willing to help us out, and that I will add that to the list.
Thank you.
On enrollment. And the biggest questions we normally get is, when should I take Social Security, and should I take the partial Social Security I can get on my spouse's earnings, or should I take it on my own? And those are the people who can answer those questions because they have access to information we do not.
Okay, thank you.
Thank you all.